Hello, my name is Tommy Salazar. I'm a physical therapist at OrthoMontana, and I'd like to give you some instruction today following a total knee replacement, or TKA. I've been a physical therapist for 13 years, and I continue to have similar questions asked following a TKA. First question people usually ask is, when can I come out of these darn stockings? Well, those stockings are compression stockings. They're there to help reduce edema and swelling and reduce the risk of deep vein thrombosis, or DVT. Usually you can come out of those stockings in about 4 to 6 weeks, but each person is different with different risk. So let your surgeon or his or her physician's assistant let you know when you can come out. The second question I hear is, when will I get back to my normal routine? Well, that is also variable dependent on the person having the operation. But most of the time we see people back to 65 to 70% in about 6 weeks or so. That doesn't mean you'll be absent of pain, but it just means that you'll be able to do more activities and that you'll see progression. At about 3 months, we usually see people about 75 to 80%, and then 6 to 12 months is the full 90 to 100%. Your pain will go up and down, and that's very normal. As long as you're making progression over time, that's all that the medical team is concerned about. The third question I get is, why am I having so much difficulty sleeping? You got to remember, you just had a pretty invasive surgery and you're still in the acute phases of that surgery. I want to give you the analogy of the noisy neighbor. Okay, if you had a neighbor that was playing loud music during the day, you may not recognize it, or it may not be that much of an annoyance. But if that noisy neighbor was playing loud music at 1 in the morning, that'd be a different story. That'd be very disruptive. So same thing happened. You're focusing on other things during the day, and so you're not getting that impulse from the knee as much as when you try to relax at night and your brain is wanting to relax and go to sleep, and then you get all those impulses from the knee. The fourth question I get is, how often should I be moving? That's an excellent question, because movement is key following a total knee replacement. I tell people I'd like to see you moving frequently versus a big duration. So it's more important to move 2 or 3 times every hour versus a 60-minute block once a day. The first thing I explain to patients is the importance of walking. I'd like you to be walking every hour that you're awake, starting with just 2 to 5 minutes, and then progressing 5 to 10 minutes every week thereafter. As physical therapists, we like to see people walking 20 to 30 minutes without interruption by week 6. Now I'd like to show you the first 4 exercises that we usually prescribe following a total knee arthroplasty. The last question I get is, when will the swelling in the knee subside? Well, you got to remember, swelling is a natural occurrence. And we, as physical therapists, are going to try to help you to reduce that swelling, to make the knee feel looser, and to decrease some of that tightness or pain feeling. But the 3 musts to help reduce your swelling is movement. Movement is key. Walking, just moving around every hour. The second thing is elevation. Just make sure you prop the pillows under your heel and not the knee, and your leg has to be elevated above your heart. The last is the compression stockings that we already talked about. Those help keep the blood from pooling below your knee, and as you move, it pushes that fluid out of there. First exercise is a hamstring and calf stretch. It's used to keep the knee straight. The stretch should be prolonged, static stretch with no bouncing. It should be held 30 to 60 seconds each time and at least 3 times. I usually ask my patients to perform this 4 to 5 times a day. Second exercise is a quad set. The quadriceps muscle is a group of 4 muscles in the front of the thigh. They usually atrophy after so many years of osteoarthritis and also inhibited following the surgery. These muscles are vital to the return to function, and we want them to get turned back on as soon as possible. You could sit in a chair or on your bed. You're standing with some weight through your affected leg. You should focus on tightening your thigh so your knee becomes straight. Hold that tension and knee straight as long as you can. Get for 5 seconds and then relax. Repeat this 10 to 15 times. Again, I ask my patients to perform this 4 to 5 times daily. Third exercise is the short arc quads exercise, named for the small range of motion it covers. In a reclined or lying on your back position, place a small roll under your knee. You can then lift the lower or distal part of the leg up and hold the position for 2 to 3 seconds each time, repeating it 10 to 15 times. Your focus should be, once again, your thigh muscle. This should be performed 4 to 5 times daily. Last or fourth exercise I give patients is the seated knee bend. While seated in a standard chair or off the edge of your bed, provided you have the room to go into your end range of motion. Take your uninvolved leg and place it over the involved leg as shown. Gently pull the affected knee back until you feel a gentle stretch and hold 10 to 20 seconds. Repeat this 10 times, 4 to 5 times daily. Do not push this motion too hard as it can increase swelling some. I usually tell people push to pain, not through pain. This is best on tile, wood, or laminate floor to reduce the friction of your sock or foot sliding. It's best to use the same location to perform this if possible, so you can use visual aids such as a line or design on the floor to ensure your toes are going further back each day and you're making progress. Overall, there are many folks that undergo a TKA. I just want you to stay encouraged and stay patient. At no time should this video be a replacement for physical therapy. Physical therapists are trained professionals in movement. They will know compensations and things that could further injure you and help to scale down exercises or progress exercises as needed. Should you have any further questions, please contact us at OrthoMontana.